Hello there. Welcome to RN Instructor channel. Today we are going to talk on drug calculations. Let's begin. Unit conversion. 1 kilogram is equal to 1000 grams. 1 gram will be equal to 1000 milligrams. 1 milligram is equal to 1000 micrograms. 1 liter is equal to 1000 ml. 1 hour is equal to 16 minutes, right? This is very essential to continue the drug calculations. Here, the conversations can be like micrograms can be converted to the milligrams can convert to grams and then kilograms. Whereas if you are receiving in the question like kilograms and you need to have like the grams, or you have the kilogram and the doctor order is in the grams, you can convert from kilograms to grams, grams to milligrams, then to the micrograms, and the larger to the smaller units also. So from the larger number to the smaller number we need to multiply, whereas to get from the smaller number to the larger unit we need to divide it. So this just keep in mind, multiplication and division. This is just an example, okay? To get from milligram to a liter you need to divide it from smaller to the bigger number, whereas from liters bigger number to the smaller units to the milliliters you need to multiply it. Okay, so this it will be useful in your questions application. I would request you to please keep on writing meanwhile when I am also explaining to you. That will be more beneficial, because I always keep saying to my students that keep on writing. Okay, this is the very basic formula, universal formula. Desire dose divided by dose in hand or stock in hand, multiply by total volume, then you will get the exact dosage what you need to administer to the patient. Okay, this basic formula you can apply to any of the forms of tablets, capsules, syrup, vials and ampules. Okay, read carefully the first question. A client is prescribed with amoxicillin injection 700 mg IM every 12 hours. Stock on hand is 500 mg, that to be diluted with the 5 ml of normal saline or the distilled water. So here you need to make sure when you are reading your question what is the desired dose, that is your doctor's order. Okay, then what is in your stock in hand? So here first write down the basic formula, desired amount or the doctor order divided by stock on hand, that to be multiplied with the total volume. So here the doctor's order is 700 mg and stock on hand is 500 mg, that to be multiplied with the 5 ml, that is your diluent. So when you will calculate it, you will get 1.4, that to be multiplied by the 5 ml, and you will get the answer, that is the 7 ml. Before moving to the next question, I would request you, if you have not subscribed my channel, please do like, comment and subscribe, and let's continue. Second question is injection acetaminophen 500 mg IV. The available dose on hand is the acetaminophen 250 mg in 5 ml. So how many ml will you administer to your patient? So by applying your basic formula, you have got the doctor order is 500 mg, the desired dose, that the stock in hand is 250 mg, that totally divide and multiply with your 5 ml. Then when you do the calculations, you will get 2 multiplied by 5 ml and the answer is 10 ml. I guess this is very clear for you guys. So let's continue for the next question. So the order of erythromycin 750 mg by the doctor. On hand you have 250 mg capsule. So how many capsules will you administer to your patient? Read the question very carefully. Here we do not have the tablets or the injection. It is in a capsule, so that will be like one capsule. So by applying your basic formula, you get 270 mg, that to be divided by 250 mg with one capsule, that you will get 3 capsules you will give to your patient. This is another type of calculations. Here you need to be pretty sure that what is your doctor's order. Sometimes the doctor will write some of the mg or mcg drug multiply with based on kg or per dosage per kg, then you will get the required dosage. So per kg or per minute or per ml or total dosage or hours, this you need to be very sure on it. Okay, we have two types of kgs in this. We need to conform kg or in the pounds. Here we are just going to consider with the kg. So the question is gentamicin injection 2.5 mg per kg per dose. Okay, in each dose you need to give only 2.5 mg per kg. Okay, every 8 hourly. So just unseen 8 hourly. Here the weight of the patient is 20 kgs and the stock on hand is 80 mg in 2 ml. So here first of all you need to convert the 2.5 mg per kg. So when you apply this, you will apply the formula, the previous formula what I have shared with you, that you need to apply over here. So weight in kgs that to be multiplied with the dosage of the doctor. So 20 kgs of patient that to be multiplied by 2.5 mg. Okay, then you will get like example 50 mg. So here first you need to calculate the mg per kg. Then the second step, by using your basic formula now. So here you are going to get 50 mg by 80 mg, that to be multiplied by 2 ml, you get the answer 1.25. So the next question is IV calculations, IV fluid calculations. Amount of solution to be infused to the patient divided by hours to be infused, ml per hour formula. Okay, this is another formula than your basic formula. So the question is 600 ml of IV fluids to run for 15 hours. So how many ml you will administer to your patient? By applying the ml per hour formula, the amount of solution is 600 ml to be divided by hours to infuse is the 15 hours. Then you will get the 40 ml per hour you infuse to your patient. So the next question is 1000 ml of IV fluids is ordered to run for 125 ml per hour. So how many hours you will administer the IV fluids to your patient? So by applying your ml per hour formula, the amount of solution is your 1000 ml. So here you do not know exactly how many hours you need to administer, but there is a fluid flow of 125 ml. It's going on. So how many hours you will be giving this fluid to your patient? So here I'm having like 1000 ml divided by hours, that is the question mark. You need to find out that to be cross multiply with 125 ml, which is on flow, divided by 1, means every hourly. So here when you will do the calculations, you will get 1000 ml to be multiplied by 1 divided by 125. So you will get 8 hours. So how I can confirm this is by again applying our this ml per hour formula. Actually this is a little tricky one. You just need to conform in both the ways. Once you get the answer, you can again apply it as ml per hour formula. Then if you are getting the same answer like 125 ml per hour, then your answer is correct. The next question, the doctor prescribed 1 unit of PRBC to be infused for over 2 hours and 15 minutes. The unit of blood contains, that is the total amount, is 250 ml. The drop factor is 15 drops per ml, and how many drops per minute you will set on. Here you need to read the question very carefully. By giving the questions like this, the examiner will make you having like a twist that 1 unit is there, as well as here 15 drops, 15 minutes is there. So here you are going to apply amount of fluid multiplied by the drop factors, that whole to be divided by minutes. Okay, so here I have just highlighted in the red color what you need to take from your question. That is the amount prescribed is 250 ml of PRBC, 1 unit PRBC, and to be multiplied with the drop factor. DF is the drop factor, or also known as GTT. Okay, GTT means 1 ml is equal to 15 drops here. Okay, that to be whole divided by 2 hours. Hours need to multiply in minutes, that is the 60 minutes, and that you will be adding with your 15 minutes, because in the question is there 2 hours and 15 minutes. Okay, when you will solve this, you will get 3750, that to be whole divided with 125 minutes plus 15 minutes. So you will get the answer 28 drops per minute. So here, gentamicin 80 mg in 100 ml normal saline is to be administered over 30 minutes by using the drop factor 10 drops per ml. So how many drops per minute you will set the flow rate to? So here you are not going to focus on 80 mg, because the question is not to find out how many mg you will give. So 800 ml, that to be multiplied with the drop factor, that is 10, the whole to be divided with 30 minutes, because here the question have not mentioned how many hours, or hours is not given, it's in minutes. So directly you can apply the 30 minutes. So when you will do this calculation, so you will get 1000 divided by 30 minutes. Okay, then you will get the answer like 33.3 drops, that approximately 33 drops per minute. Hope you have liked my video. Please try to comment, leave a comment, subscribe, like, and share with your friends who are also nurses struggling in their initial career stages. Okay, thank you.